Hello and welcome to the MPUG Virtual Project Conference session, Project Management for Healthcare. Today we're going to discuss what's different about projects in the healthcare industry and how project management skills, best practices, and Microsoft PPM solutions can benefit healthcare professionals. Quick background about myself. My name is Michelle Manumtum. I'm from Tivity and I will be your host today. I have been designing, implementing, and supporting project and work management solutions, or overseeing teams that are implementing project and work management solutions for about 12 years now. I really enjoy helping organizations get the most out of their PPM solutions. And currently, I am the Director of Client Services for Tivity. And Tivity is a Microsoft solution provider that is focused on implementing business productivity solutions on the Microsoft Cloud. Leveraging Office 365 and Project Online, we are able to meet a variety of needs for our customers looking to implement project management and portfolio management solutions. And recently, we've partnered with the Microsoft project team to develop a solution that's really focused on the healthcare industry. And that's what we'll be reviewing today. So let's go ahead and kind of set the stage of the current state of the healthcare industry. The healthcare industry is seeing a surge in project management growth to support all of these initiatives that are being driven by federal legislation. The Patient Protection and Affordable Care Act has proved to be one of the most impactful federal legislation on the healthcare industry since Medicare and Medicaid. And the ACA has resulted in incentives and enablers for the implementation of these electronic health records. And along with that comes the associated meaningful use and procedural changes, and now moving into health information exchanges. So all of these initiatives, coupled with movements to patient-centered care, evidence-based medicine, centers of excellence, and all these other forces bearing down on the healthcare industry, have spawned a current climate of really what may be an unsurpassed number of healthcare projects going on within the U.S. and within even globally. But on top of all these demands that are driving the need for projects to be delivered successfully in order to meet the government regulations, in order to drive patient care, quality initiatives, these healthcare organizations are facing challenges with reductions in revenue coming in from sources such as Medicare, Medicaid, and other third-party reimbursements. And they're also experiencing rising costs. And this is making it a very, very challenging time for the healthcare industry. So what do we need to do in order to meet these challenges? Well, healthcare leaders and the clinical side of the business really have to understand and appreciate the value of project and portfolio management. It's critical with all of the demand of these projects coming in and the limited budgets that they have to implement these projects that healthcare organizations strategically select the projects that are going to deliver them the most value. And on top of that, once you've selected those projects, you need to execute on them successfully. Now, the good thing here is that having executive stakeholder and key stakeholder interest in projects and support for these projects actually have a direct correlation to improving the project success rate. So the good thing here is these are really tied together. So we can basically implement a good PPM solution to select the right work, and that's going to drive us into being able to perform that project successfully. So let's take a quick look at what's really unique about project management within healthcare. Well, healthcare is, as we mentioned, is a rapidly changing industry, driven by both government and patient demands. And care quality, cost containment, and external review are key characteristics of healthcare projects. Obviously, as we spoke to earlier, government and regulatory agencies are playing a big role in driving the demand, as well as making sure that we execute on these projects successfully. And the other side of the coin is that many of these projects are actually affecting clinical workflow. The clinical team is passionate about the quality of patient care. It's crucial to them. And so driving this additional demand on top of those resources can be challenging at times. Now, another piece of the puzzle is healthcare data is very personal. So you have a lot of compliance and regulations from a data standpoint to ensure that you're meeting all of these rules and regulations. Now, the good thing is small changes in project success rates can really have a large impact on patient outcomes and delivery costs. But expertise in the industry is critical for this project's success. And so what that's going to require is strong collaboration across multiple teams, multiple skill sets. And last but not least, healthcare has unique terms and processes, so their deliverables and metrics may be different. So as a scorecard is always important and is going to help you make business decisions, it's delivering on the right metrics in order to communicate that to the clinical staff and the healthcare executives. So let's talk about that a little bit more. Clinicians view project success differently. The traditional notion of the triangle of scope, time, and cost can be translated in a clinical perspective to driving efficient clinical workflows, improving patient safety, and ultimately delivering outcomes. So going into a couple of different roles within the organization and what are the challenges that they have? Well, there's really two camps of staff typically in a healthcare organization. We have our clinical staff, which is patient-focused and represented on this slide with physicians and nurses, although I know there are many more roles on this side. This is just a subset. And then we have the business-focused side, the executives and the project managers. They're looking at enterprise viability and sustainability. So from the clinical side of the house, the physicians, the nurses, they're really looking to ultimately at the end of the day enable me to provide the best quality of care to my patients. But they're also trying to be innovative and practice evidence-based medicine and offer more preventative services to be proactive versus reactive. And on top of this, they've got more and more patients to see, less funding coming in, and more data to analyze and enter. And then on the left hand of the side, we have our project managers and our executives. And ultimately, at the end of the day, the executives are trying to run a financially sound business, but with rising costs and decreased funding. They also have to comply with all these federal regulations. And so trickling that into the project manager role, the project managers are expected to deliver on all of these projects successfully that are going to help drive these clinical outcomes and improve clinical outcomes and patient safety and drive productivity. But this is in a very highly cost-sensitive environment. And in addition to that, they may or may not have a clinical background. And as we mentioned earlier, the clinical expertise is critical to the project success. So they have a unique challenge of being able to communicate across a variety of stakeholders, senior management, and clinical experts. Communication is key for the project management role within the healthcare industry. So here's just a snapshot of some projects that span across the organization. Now, obviously, there will be projects that stay within their own department, such as HR or IT or a marketing campaign. But there's a lot of projects that are actually extending and impact a variety of departmental areas, from IT to administration to the clinical setting. And this results in a variety of challenges to successfully deliver on all these projects. This is actually an interesting note. I think this is what's driving in healthcare organizations the enterprise PMO and having the IT PMO really evolving outside of just IT and helping to support the variety of projects that span across multiple departments, divisions, regions, and functions. So as the healthcare industry becomes more complex, particularly within project management, and the demand is coming in, It's even more important for people to develop processes and best practices that can be reinforced with tools. Now, Project Online can assist project managers and their teams to carry these projects out successfully. Project Online can also support the executive team and the PMO in helping to align the projects to the strategy of the business and select the right projects to move forward with. Project Online, being built on Office 365, is going to provide a secure and a holistic collaborative experience for the project managers, executives, resource managers, team members. The whole team is going to be able to collaborate within one platform on the single source of the truth. Now, Project Online, being built on Office 365, which will host all of the productivity apps that you're used to and that you love, also is integrated with Power BI. Power BI is Microsoft's new visualization tool to help turn data into more meaningful interpretation for the executive level and give them one place to go, whether they're looking at project data or financial data from a financial system. They can just go log into their Power BI application, which is fully mobile, and have access to the single source of the truth and become a data-driven organization. And the whole platform is built on a very solid infrastructure. Microsoft has Office 365 has redundant data centers. It has 99.9% uptime, and it really is trusted security, and it's HIPAA compliant. So to go a little bit deeper into that, I want to make sure that we alleviate your concerns with a cloud-based solution. We want to make sure you understand that Microsoft is 100% committed to supporting the healthcare industry. They truly understand the importance of safeguarding electronic protected health information, and their compliance, supporting policies and procedures as a business associate are aligned with your own as a covered entity. Their cloud offerings really help enable our customers to realize tangible benefits such as cost reduction, business agility, flexibility, and scalability, all within meeting the compliance support for regulations, including, but not limited to, HIPAA and high tech. So now let's take a look at what a healthcare PPM solution looks like leveraging the Microsoft Office 365 platform. Okay, so here we are in our Office 365 healthcare portal. As I mentioned, this is fully integrated with Office 365, so you have all of the capabilities to collaborate on email, social collaboration, your OneDrive for document management, all of the productivity apps such as Word and Excel, along with all of the new apps that Microsoft has been releasing such as Delve and Sway. So it's a really truly integrated experience. What I'll do is go ahead and click on My Projects because I'm going to take us into the Project Center. So here we have a list of projects within the system and a central portfolio of projects so that you have that single source of the truth. This view in particular is grouped by requested, approved, and in progress projects. What we're going to do is go through a life cycle of a requested project and take you through the analysis portion of it. I wish I could show you every bit of every feature of Project Online, but that we just don't have the time for that. But I will try to hit on some of the highlights that I think you'll appreciate. So the project here, Vapor. Now this is a project that has been submitted, and the business case behind it is actually trying to reduce the number of ventricular acquired pneumonia. So with this type of scenario, with this type of pneumonia, it's actually acquired after the patient has been submitted into the hospital. Now this not only affects patient safety as well as driving legal risks as well as decreasing the funding of reimbursable dollars to the hospital, it's going to improve the overall patient safety. So what we're going to do is take that project, sounds like a great idea, through the analysis and see if we can fit it into our portfolio, if it's going to deliver us enough value with the projects that have also been requested, such as these other neurology clinic or the personal health device communication, as well as all the projects that are already in flight. So let's go ahead and go into Microsoft Project here, and I want to show you a quick view. Let's say we've created this project as a high-level schedule so that we understand what is it really going to take to do this project, at least what do we think it's going to take to do at this stage of the game so that we can build that business case. So here's all the high-level tasks that are associated to it, and in order to do this analysis, we have cost constraints, but we also have resource constraints. So I'm going to go into the resource plan. Here in the resource plan, you can see a set of generic resources, and this is a new feature that's available in Project Online. It's available in the Project Desktop 2016, and it will be available in the on-premise version that's released in a few months here. So this is resource engagements, and what this allows you to do is put together some high-level resource capacity plans and share that information with the portfolio analysis process, as well as once you get into the execution process, requesting resources and collaborating more effectively with your resource manager. So here you can see we've got a client device specialist. We want their support for the Vapor project. These are the estimated timeframes that we'll want to have those resources. And this is the allocation that we're looking at. Now each resource has a rate associated to it, so it can actually drive costs as well, so you'll understand the cost impact of the project. And this is real easy to work in. I can easily type in 25, let's go ahead and change this to 30%. I can say, I think this probably is going to go up here. I don't think we're going to be able to let go of that resource until we get back into the August timeframe. This can be planned in hours and or percentages of FTE. Now, once I've got that, I would save and publish my plan, and that's going to share this information with Project Online and let me take it through the analysis process. So what I'll do now is go back to Project Online, and I want to take you through the portfolio analysis process. So within your portfolio, you can have a variety of different groupings of portfolio and different analysis that you do according to a region, according to a facility, according to a service. So this is something that can be elaborated on based off of your specific needs. And what we'll do for this purpose, is because it's the Vapor project, we're going to go ahead and go through the clinical projects scenario. So each scenario has its own unique name, and it can have other unique attributes associated to it, such as departments. So if you just wanted to associate it to a specific department. If you wanted to have different scenarios, for example, if you wanted to analyze this scenario based off of what the chief medical officer thinks is most important versus what the chief quality officer thinks is important, you could do that. In this scenario, we're going to use the clinical executive consensus, which is basically everybody's kind of gotten into a room and agreed that these are the most important for the clinical team as a whole. And what this does is basically takes the business drivers that are important to your business and does a pairwise comparison to say which business driver is more important, A or B. Then it takes you through the process to analyze that against each business driver so that you can have a weighting associated with each business driver as you go through the project prioritization process. So now I'm going to go ahead and go into the analysis here of the business drivers. So here we've been able to collect the assumptions from a project manager or the project requester of how they are aligned with the different business drivers. Now this can be top-down only, it can be a bottom-up, top-down, or it can just be bottoms-up. It's up to you. Prefer a mix of top-down and or top-down and bottom-up. And what this does is basically takes each project request, those are on the left-hand side, and the projects that are in flight, and has alignment associated to it. So for example, how does it improve patient safety and care quality? Is it associated to improving our regulatory compliance? Will it help us improve our service time? Is it aligned with our physician strategy? So these are the different business drivers that would be unique to you. These are just some standard ones that we've come up with based off of best practices that you would be able to identify and align with. Now in this example, let's go ahead and look at the Vapor project. So this project definitely is going to improve patient safety and care. We're going to be reducing the number of pneumonia incidents after the patients have been submitted. It's also going to help with regulatory compliance, and it's going to extremely be aligned with our physician strategy because they're most impacted if we have any of these incidents that are post-admittance and that won't be funded and reimbursed. But you can also change these. So if you wanted to, at this point in time, go ahead and update this to be low or moderate, low or no rating, you can do that here during this process. So now that we've aligned each project to the business drivers, what the system has done is given us a prioritization score of what's going to be delivering us the most value based off of its alignment to the business. So you can see here vapor is sitting pretty close to the top, and it's at 6.55%. Now the key piece here is we've got all these priorities associated to these projects, but we have a limited budget and we have limited resources. So based off of that, which projects should we choose that's going to deliver the most value? The inpatient system upgrades may be the highest priority here, but it may be very expensive, and we could deliver more value by doing a collection of projects versus just that one project. I'm not sure that that's the case, but we're going to go ahead and go into the next phase, which is going to let us analyze our cost. So in this scenario, I'm going to go ahead and go into the $35 million budget. So in this scenario, we have $35 million that we can allocate to these projects. So based off of that, we can't do everything. We can, however, do enough to where it's going to deliver us 84% of that 100% value based off of all of the projects. So you can see here we've got the selected projects, and then below here we see the unselected projects. So the system has basically said, these are the projects that we think will deliver you the most value. Now, obviously there is some type of human interaction here, and there may be projects that you are required to do. For example, the ICB-9 to ICB-10 migration. We could say that one is actually required. We need to do that one. So I can go ahead and force that one in and recalculate, and what it's going to do is give me a new score based off of forcing that in. Okay, if we're going to have to do that one, then what's going to happen? So this is going to basically drive, we went down a little bit, but not too bad. So that's still good. The other concept here is you can actually adjust your budget. So let's say you only have $30 million for your projects. So you can recalculate and come up with another scenario based off. And the nice thing about this is it stores all of these in history, so you can easily compare. So once you've collaborated and gone through these different sessions and come up with your different scenarios, you can now compare those scenarios and understand, okay, with our $35 million budget, we can deliver 84. Based off of the input that we had in our last working session, we're looking at about 77% of the value, and these are the projects that we would be working with. So it's a really nice tool to use for that selection process. Now, if we go into, we've talked about the costs. We have a budget constraint, but we also have resource constraints. So if I click next, we'll go into and look at the resources. So what this is going to do is take the projects that it recommended that we move forward with based off of our budget constraints, and now saying based off your resources, these are the projects that we recommend, and you need to hire 2 resources. So you can see here, there's a 2 here. You could do analysis of what if I hire 4? Could we do all of the projects? What if I don't hire any? And then it's going to push another project out. But this is basically going to allow you to do that analysis and see, based off of your constraints from both a resource and a budget standpoint, which projects should we do. Now you can also update start dates and try to push things out so that they're not all stacked on top of one another, and see if that helps as well. So again, these are all different scenarios that you can use to help make the right decisions on which projects you should move forward with. And one of the questions I always get here is, well, it tells me I need to hire 2 resources. Well, what resources do I need to hire? I don't know. So basically, based off of those resource plans in the system and the information stored that's associated to each resource, you can actually see the hired resources report, and it's going to tell you these are the resources that you need based off of what projects we've selected. You need 2 resources here, a support analyst and a clinical device specialist. These are the projects that they need to be working on, and this is the start and end date and approximate cost associated to them. So it gives you a lot of information and insight in order to make the right decisions and how to plan your portfolio of projects. Okay, so now let's go back into the Project Center. The Vapor project, yay, you're good to go. You're going to be able to go into the execution stage. And the nice thing about Project Online is Project Online supports project types, which each project type comes with its own project schedule, project workflow, project team site, and project metadata. So based off of your organization, you can tailor the system to meet those needs and help kind of standardize and automate on those processes and best practices. So for example, if I go here new, I can see these are the different project types. So we may have project types of categories of kind of projects. We may have project types that are based off of the size of the budget that's required, and it may have a different workflow. So we may have projects that are different methodologies, for example, PMBOK versus an Agile methodology. So Lean Six Sigma. So these are all different ways to leverage the project types. And as I mentioned, each project has its own workflow. So if I click on the Vapor project here, you'll see that there is a workflow visualization here. This is a very simple one, but it can get as fancy as you'd like. So basically, if I scroll down here, I can see these are the different phases of my workflow. It can trigger actions. It can trigger approvals, so that this is helping to automate that process and drive that visibility to the entire team as the project goes through its life cycle. So I'm going to go back to a project that's in execution for the purposes of the demo today. And we'll look at the application networking service and patient implementation. So at this point, your project can be managed in either, the nice thing about this is either the project online web planner or within the Microsoft Project Desktop. So when you're setting up your schedule, it depends on what level of complexity your schedule is going to be at and what tool of preference that you like as a project manager. Do you want something more web-based that's lightweight, using the online planner, or do you want to use Microsoft Project? And the nice thing is it's all intermixable. So if you create a project in the online planner and now you're ready to open it and work with it in Project Desktop, you can do that, and vice versa. So very easy to work with. And so let's go ahead, and I wanted to show you the different project metadata. This is all the project metadata that's really storing and attaching itself to a project so that the reporting on the back end can be accomplished. So this is helping you establish some standard languages that can be shared across the organization and used in reporting so that there is that one single source of the truth. And again, this can vary based off of the different project types. And the last piece of the puzzle for those project types is showing you, I wanted to show you that you can have team sites that can be tailored to those specific types of projects. So whether you have unique document libraries that you want to collaborate on documents and store templates in, or share a calendar, or leverage Yammer for your enterprise social, manage issues, risks, change requests coming in. This is a one-stop shop for your project that you can go and your team can collaborate on everything about that project and easily access it through one familiar interface. So, as I've taken this project, I've published it out, I've been able to centralize my schedules and centralize my projects. As a team member, I can go to my project team site, I can collaborate with my project team there, I can work on documents. I can also have visibility into my work. I can see what's actually assigned to me from a scheduling standpoint and update information and collaborate with my project manager. So this is just a view into the different tasks that have been assigned to me. I can either capture timesheet information and or status information and share that with my project manager. The project manager can accept or reject that information and incorporate it into the schedule. So you have a really good synergy between your team, your project manager, and then ultimately your executive team that's going to be looking at this data for reporting purposes. So last, well not last, I'm going to go through the executives as well, but let's go look at the resource manager hat real quick. So as I mentioned, with Project 2016 and Project Online, Microsoft has really done a great job at incorporating more, and I say Microsoft in general is really going more towards a user-focused designing approach. So they're looking at how the user interacts with the system from their perspective. And the resource manager role has really shined based off of this last release with the resource engagements. So if you remember, in Microsoft Project, before we went through the portfolio analysis, I actually created these different resource plans based off of generic role sets. Now I could do this off of generic role sets, or I could actually put a person's name in here and request a specific person. But the big thing about this is I can now collaborate with my resource manager. I can submit these requests for review for my resource manager. They get a notification and they can go into the system and actually allocate resources based off of the information that's been provided to them and based off of what the resources are currently allocated and working on. So I can submit this request, and you can see that we have several different generic resources here. So as a resource manager, I can come into the Resource Center. Let me go ahead and change my view. Oops, I need to submit these. So I'm going to submit all of these engagements for review to my resource manager so that you can see these are the different resources that I'm managing. Let's say I'm managing the clinical system support team. So these are my real people that I'm managing, and this is my generic resource that has been submitted for staffing for that Vapor project. So what I can do now is go into resource requests. So as a resource manager, I can now go into the resource requests, and in here, I'm going to change this view to the engagement details. And I'm going to collapse these committed requests. These are all of the resources that I have and what they're committed to already. Now I've got the proposed items here, and these are the items that are actually waiting for my approval or waiting for me to assign a real resource. So here's our clinical systems analyst that's been requested on the Vapor project. And here are some other resources that have been requested by name, as I mentioned, and just haven't been committed or approved. So at this point, I'm not quite sure who should do this work. You can see here you've got the proposed and the committed work here. And they've proposed some hours here for the clinical system support analyst, and I'm not quite sure who I want to do that yet, so I'm going to do some analysis here. And to do this, I'm going to move into my capacity planning view. And this is a nice heat map view that can be tweaked by you, but you can see here you can show your over and your under. And so anybody in red is over by 10%, anybody in blue is under by 10%. Obviously you can tailor this to your specific needs. So here's the generic resource for the clinical system support analyst, and here's the Vapor project. Well, it looks like you can look at this in hours or FTE. Right now we're looking at it as full-time equivalent. I can change that if I'd like to. I like full-time equivalent, so I'm going to keep it there. So about 0.3 and about 0.8 in July. So who can do that work? Well, obviously, we can't leverage this resource. They're way over allocated. So let's go ahead and look at the different blue resources. I think Vicki needs some work. Let's go ahead and assign it to her. So we'll go back to the resource requests. And look at our resource here, clinical system support analyst, and what this is doing is only showing me the resources I have selected within my view. So it's not showing me the entire resource pool that I have to filter through. So I'm going to go ahead and associate Vicki to this. And the nice thing about this too is if I wanted to, I could actually change the proposed work at this point in time. So let's say I wanted to update it to 40, or I wanted to say you can only have her for 20 hours or 80 hours. All of that can be tweaked based off of your perspective from a resource manager. And so at this point in time, I can click accept, and that's going to send a notification to the project manager, so they'll have a resource that's allocated to their project. And this can go back and forth as many times as you'd like. Obviously, we hope that you talk eventually. The system can't completely replace the communication aspect of resource management and planning, but it does give you help helpful visibility, notification, and collaboration elements. Okay, so last but not least, let's go in and turn our hat around to the executive role. And now that we've got all of this good data in the system, what we can do with it and share it with our executives. So I'm going to go into Power BI, and as I mentioned, this is Microsoft's new BI tool for accessing information and really helping your organization become a more data-driven decision-making organization. All of this information is coming from our Project Online system, and as we talked about earlier, we've aligned the KPIs to map more to the healthcare industry so that it resonates with those executives. So within this view here, we've got a view of our strategic portfolio. So these are all of the projects that are going on in flight, and understanding how are they doing against the strategic nature of the business. So for quality of care, we've basically looked at a gauge here, and we were targeting 8. We've actually received a 7 here, so we're doing fairly well there. For portfolio cost, we are a little bit above target, so we may have a little bit of work to do there. And for return on investment, we've actually are doing better than what we had initially targeted. So this is a nice way for me to visualize the data and interpret it in a much easier fashion than having to look at a bunch of spreadsheets and tables and grids and that type of thing. Down here on the left-hand side, we've also got a strategic bubble chart. So on the left-hand side, you've got quality of care, and on the lower grid, or the lower line, you've got the total cost. So obviously, in this scenario, we would want to look at projects within this region over here that are going to deliver a high quality of care with a lower cost. And as you hover over each of these bubbles, it'll actually give you the information and more details around those different projects. So here we've got urgent care infrastructure set up at a total cost of $35,000, quality of care at 8, and a return on investment of 0.78. This project over here, critical care equipment upgrades, the cost is $250K, and the quality of care is 8, and the return on investment is 0.31. So you can see this project maybe is not delivering as much value based off of the cost that's associated to it. Now on the right here, we've got a list of all of our different projects going on, and understanding the return on investment is the right-hand grid here, compared to the risk associated to the project. So for example, the red items are high-risk projects, and the green are low-risk. So for these two projects up here, we're delivering about the same ROI, but one is a high-risk project and one's a low-risk project. Now, all of these reports can be configured to meet your specific needs. These are just some sample out-of-the-box reports that we have available that we've created based off some best practices. Now, the nice thing about these reports is you can actually drill in as well. So let's say we wanted to go in and look at a little bit more details, or we wanted to look at a specific portfolio of projects, a specific region, or a specific service. All of those categories can allow you to slice and dice. So for example, if I wanted to look at the patient health consumer portfolio, this is going to dynamically update the information that I'm viewing to reflect only those patient health consumer portfolio projects. You can see the projects down here are all listed. So there's our Vapor project, and it's on track, and it's in the executing stage. You can also see a sum of the average ROI. So this is basically looking at just those projects that are selected now against your targets, and then it's basically filtered within the bubble chart to reflect only that portfolio of projects. We've also got some information around the execution of the projects. So this is basically quickly showing me overdue and upcoming milestones and identifying what project they're associated to. It's showing me baseline and remaining cumulative work. This is basically kind of similar to a burn down chart if you're used to that in the Agile world. We've also got our planned work versus baseline work associated to each project. Active risks, active issues. So basically really giving you an overview of how the projects are executing. And then I'll show you two more just for the purposes of this demonstration. I'd like to show you the portfolio status report. It gives you a little bit more insight into the detailed projects and the detailed portfolios.
So this is looking at your portfolio on the right-hand side, and you can slice and dice. So let's say we wanted to look at innovation. We could look at innovation. If we wanted to look at information portfolio, that would show up here. So this is basically giving you a portfolio summary view of how the projects are going within those specific entities. Now let's look at the project level. So here's our project status report. So this is basically automating probably what if you're generating status reports, and I'm sure you are, a lot of the work that goes into collecting the data associated to these projects and consolidating that into one status report so that you have one place to go and can get an insight on how these projects are doing. So here's the HIPAA data compliance implementation. It's showing me how the overall health of this project is doing, some high-level information around the project, how much have we completed of the project, our key milestones associated to it, and a visibility into the work and the actual work. The planned work and the actual work. So these are just some examples of what you can do with the Power BI reports, and we have about 25 reports that basically we can offer to get you started, and then you can basically build off of that and create your own customized user-focused or role-based dashboards based off of those different reports. The really cool thing about Power BI, which I really like, is let me take you back up to the dashboards here. The nice thing about this is it's really easy to use. So for example, if I don't understand how to create these reports, I'm not an Excel guru, I'm not a report writer, I can, as an executive, just come into the system, and I'm gonna go ahead and minimize that there. And let's say I wanna see total active issues. All right, let's go ahead and count. So I've contextually just searched, similar to a Bing search or a Google search, of what are the total active issues associated to our projects. So this is basically going out and querying the data set and coming up with an answer for me based off, and a visual answer based off of what I'm looking for. Now I can even say I'm not really fond of the bar chart, so I'm going to go ahead and make this a pie chart. So now I can see it in a pie chart, and this is all done through just a contextual intelligent engine behind the scenes that Power BI offers in order to make reporting and visualization much easier for your executive team. And the really cool thing here is I can just pin this to my dashboard. So let's say I want to save this. I like this report. I can pin it to my project execution dashboard. And now it's going to show up on that dashboard by default. And I can move it around. I can make it larger. Let's go back over here. I'll show you so you know I'm not lying to you. Here's the chart we just created. And again, I can say, I want this to be up here, over here. In this section, I can edit the title, that type of thing. So very easy to use, and all of this is accessible via a mobile app as well. So whether you're on your phone, your tablet, or your PC, or your laptop, or your Mac, you'll be able to access this information and get insight into that visibility of the single source of the truth. The whole reason that you implement these enterprise systems is to access the data and be able to make decisions off of that. So having this ability within the Power BI platform is very powerful for an organization. Okay, so now that you have seen a demonstration of the Microsoft PPM platform and how it can support the healthcare industry and their project and portfolio management needs, I just wanted to show an interesting slide that is based off of a recent Forrester study that basically showcases the value of implementing the Microsoft PPM solution. They interviewed several customers and came up with the results of the economic impact of implementing the Microsoft PPM solution. And I think it showcases some tremendous value for an organization. And if you'd like more information on this, I put the link at the bottom, and you can get more insight into the Forrester study. It's also off on our website at project-online.com. Underneath our insights, we did a blog on this as well. Now, if you'd like to learn more about healthcare project management, we actually partnered with the authors of Healthcare Project Management, Kathy and Dan, and they did a really good job of aligning the healthcare industry along with other best practices such as PMBOK or Lean Six Sigma and relating it to the healthcare industry. So we are doing a book raffle, and as part of thanking you for your participation and attending our presentation. So if you're interested in learning more and you want an opportunity to get the book, just email us at info@tivity.com, and in the subject line put MPUG Healthcare PPM. And we'll be sure you get entered into the raffle. And if you don't happen to win the raffle, the book is available at Amazon.com. You can read it on a Kindle, or you can get the paperback as well. And one more offer that we want to do as a thank you for attending our session is we can help you with a PPM assessment and roadmap, as well as helping to build that business case. So we can help you understand the total cost of ownership and what it would take to implement Project Online for your organization, and what the value and the savings would be longer term. Now, if you're just interested in getting your hands on the system and you want to try out Project Online, we can help you there as well. Just give us a shout out at info@tivity.com, and we can schedule a demonstration so that you have a kind of a one-on-one demonstration focused on your needs, and then we'll set up a Project Online trial for you. And last but not least, I just wanted to provide my information up here so you can reach out to me. I would love for you to connect with me either via email and or on LinkedIn. Couple of other areas here. If you're interested in learning more about how Microsoft in general is supporting the healthcare industry, they have a LinkedIn group as our page if you want to follow that. And then we will be presenting at HIMSS next week. It's coming up very quickly with Microsoft and with St. Luke's to discuss a case study on how St. Luke's has been able to benefit from implementing an EPMO and leveraging the Project Online solution to kind of enforce those processes and build those best practices and deliver value to the organization from an EPMO standpoint. So we'll be revisiting that as a case study and demonstration. And with that, I just want to thank you so much for attending. We look forward to hearing from you, and please reach out if you have any questions. Have a great day.